Welcome back. The National Autism Consciousness Week is being observed every third week of January to raise public awareness on this health condition. Now, for this year, the Autism Society Philippines will hold the Angels Walk for Autism on Sunday to kick off the week-long celebration. And to tell us more about this, we have with us here on Daybreak the National Secretary of the Autism Society Philippines, Ms. Mona Veluz. Good morning and welcome to Solar Daybreak. How are you?
I'm good. Good morning, Claire, and good morning to everyone.
Thanks for coming in today to talk about this.
Thank you for having me.
Let's talk about autism in the Philippines. What are the statistics? You know, how many children a year or an average are being diagnosed with autism?
Well, the thing is, the sad thing is, in the Philippines, there is really no social mapping of the prevalence of autism. So what the Autism Society Philippines has had to do is extrapolate information based on global information.
Okay.
And from the global information we have, the UN, for example, states that 1% of the world population is on the autism spectrum. Mm-hmm. And for us, that translates to 1 million Filipinos mm-hmm. who are affected by autism or touched by autism.
Right.
And in the same light, it's 1 million families who are touched by autism.
Right. And in my understanding, I know that autism cannot be cured, but with early diagnosis, it can be prevented from getting, the symptoms becoming worse. What symptoms should a parent watch out for? Because normally you can see the symptoms at a very young age, correct?
Right, that's correct. Well, autism, of course, is a developmental disability. It is a sensory processing disorder, mm-hmm. and it can manifest itself in children as young as 1 to 3. Mm-hmm. So usually what parents would have to look out for in the beginning is really certain skips in development. For example, my son, who is now 21 years old, he's on the spectrum, from a sitting position, he started walking. He never crawled.
Okay.
So apparently that's a red flag right there. Oh. When you talk about the classic definitions, uh-huh. there is what they call a dyad of impairments. And it all has to do with social and communication delays.
Right, like language.
Language, and for example, a child prefers to play alone beside other children,
okay.
but he's actually just playing by himself.
By himself, yeah. Okay. So it's less interaction, and then also, I think, at a certain age, they don't do eye contact, and I think some don't like being touched.
Yes, because it's like I said, it's a sensory processing disorder. Mm-hmm. Some are very particular about texture. Mm-hmm. Some are very particular about sound, so you see a lot of them doing this.
Right.
Some of them are particular about taste and texture in the tongue. Right. Like some don't like to chew hard meat, mm-hmm. so they end up just eating rice.
Right. Okay. So if if you see these symptoms at an early age, if there's no preventative measures done, then it could get worse. And but if you do something about it, then the person can live a normal, fulfilled life. Yes. Correct?
Well, essentially, autism is not a degenerative disease.
Right.
It's nothing like that. But like any behavior, once you reinforce it or once you don't change something that is not acceptable, then it's reinforced. Mm-hmm. So it's all about assessing what the delays or what the gaps are, mm-hmm. and making sure the child or the individual grows and integrates well with the community. So, for example, if there's a behavior that you do not want to happen again, you have to make sure that the child knows that. Mm-hmm. I mean, they're very intelligent, and mm-hmm. it's all a matter of letting them know through therapy, mm-hmm. through communication, and through other techniques which professionals would know about. Mm-hmm. So it's all about intervention.
That's a word, intervention. Now, for people who don't have the financial resources or capability to hire specialists and for intervention, how do they get help? Where do they go?
Well, we are very lucky. I mean, 25 years into our advocacy, I think there's a lot of developments in terms of what is available. The government has provided a lot of services. A lot of LGUs have what they call the Persons with Disabilities Affairs Office, the PDAOs, and they are groups that help people in the community through what they call community-based rehabilitation. There are some volunteers who are trained by professionals to provide therapy.
Okay.
If an occupational therapist is not there immediately. So these efforts by the community, by civic organizations, by local government units are addressing the gaps that, because they're addressing gaps which are brought about by the fact that we do not have enough professionals in the Philippines. And the professionals we do have are localized in metropolitan areas. So a lot of provincial areas would not have a DevPed, would not have an occupational therapist nearby. So it has to be fueled and empowered by the community.
Exactly. You know, in other countries, they have as early, at a very young age, and they see some symptoms, the government will pay for the therapist to go to your home and help out the child just to make sure that, there's preventive measures. Because if they grow up and it gets worse, then the government will have to pay more for these people to sort of thrive in the community. And I think that's something that we're far from right now in the Philippines. Does the government have any services, free services to provide therapists for free?
Right. Like I said, there are units like the Department of Health who actually provide services, but these are like assessment services and therapy services.
Yes, okay.
But these are few and far between. These are in certain areas, like the National Children's Hospital, like the big cities.
Okay.
But
yeah, because here it says that only 10% of Filipinos with autism are diagnosed and 5% are receiving appropriate intervention. So why is that?
That's right. Well, it has a lot to do with, I guess, prioritization.
Okay.
I think one of the things that our advocacy is pushing for are certain changes in how the government and the society in general look at autism. For example, we want to make sure that assessment is compulsory for all children under the age of 7. For example, before you go to school, you have to have this little assessment thing. That
just like vaccination. Before you go to school, you have to present it. Newborn screening, the hearing screening.
It happens. So the developmental screening should happen. We also have to have an educational system which is inclusive. Like, if a child is developmentally delayed, they should not be isolated if there's a possibility that they can be mainstreamed. So inclusive education is another. Another one is, like I said, community-based rehabilitation. It should be an effort not just by government, not just by parents, but of the community. There has to be some activities for them during the school vacations. There should be some program for our countrymen with developmental disabilities to keep them motivated and to keep them focused on integration.
Right, like building these places where they can go.
Correct.
Like an institution.
And as they mature, we are looking at other issues like employment. We need more sensitivity training for businesses, sensitivity training for schools and institutions of higher learning. We need.
So as they get older, they can go work.
Correct.
Because it is possible. They can get jobs.
We don't want them to be a burden to society, right? So it's important. We are invested in making sure that they are productive and they are skilled when they reach a certain age.
Right. So now you have a walk for Angels Week for Autism. Can you tell us more about this?
All right. So Angels Walk for Autism kicks off the National Autism Consciousness Week. It's an annual event. We've had it since 2007.
Okay.
And essentially, this is just our community coming out and it's a show of force.
Okay.
It's a message to our countrymen saying that we are a force to reckon with. The government should listen to what we need. Businesses should listen to what we need, and the community in general should know about autism.
That's right.
So
So whoever wants to be part of this can be part of it through how do they join?
Well, all they have to do is go to the MOA Arena on Sunday. That's January 19th.
This Sunday?
As early as 6 a.m.
Okay.
The ticket gates are going to open. Just get a free ticket and, just have some fun with the community.
Okay, and their participation will go a long way.
Yes, and we are expecting around 9,000 people to come and have fun with us. Okay. It's going to be noisy. It's going to be
fun.
Yeah, it's going to be fun.
It's going to be fun for a good cause.
All right.
Well, all the best to you, Mona, and the
you.
organization, and thank you for joining us this morning on Daybreak. Thanks
Thank
for
you
coming
so much, Claire.
Thank you. So back to you, Amlin.